I graduated from San Jose State University in 2000, and I went to work at a large rehab hospital locally, which it was an incredible experience. I worked there for several years, and I really felt, as I started working as an OT, I really felt like I had a strong foundation of what I would do as an OT, and I felt really skilled in that way. But it was quickly became probably within a year or two of working, in a setting such as, healthcare practitioners, as we work in the front lines of such incredible human suffering. And I could tell that there was some skill set that I actually did not have, that um, for me, it began to express itself in heart palpitations. So I had a heart monitor placed, and I could see that, um, I noticed it was like 24 hours a day. Had heart palpitations 7 days a week. So it was like really in perpetual anxiety is what I was experiencing. And so I started really seeking, right around the same time I started a PhD program in humanistic psychology, and which was incredible. And I came upon Dr. John Kabat-Zinn's work through out of the University of Massachusetts Medical School's Center for Mindfulness. And I began to really dive into the research of that time. At the time, there's, as we know, there's really an explosion of research around mindfulness, but it was very inspiring. It made sense to me since I swim in the waters of healthcare and Western medicine. And I started integrating mindfulness into my life. And it was, actually pretty quickly, profoundly life altering. I felt I could sense even the heart palpitations beginning to, reduce, and, over time to completely resolve themselves. But in even more significant way, it changed my relationship to everything. It changed my relationship to my work. I began integrating mindfulness, not explicitly, but more sort of related to my use of my therapeutic use of self in my practice as as an OT. And I I could see the integration of mindfulness and its benefit. And I was right around the same time as well. I was teaching within the Department of OT. And after about a 4-year period of teaching, I began to really just want to bring mindfulness into my teaching. And so the Department of OT here at San Jose State said, okay, well, come and teach MBSR, because I had training at that point to teach MBSR. Come and teach MBSR, which is mindfulness-based stress reduction. Again, that's through UMass Medical Center's Center for Mindfulness. And the faculty could see that, in fact, there is, a great benefit. And so they gave me the opportunity to teach a semester-long course, and I've been teaching that since 2010, and with lots of great feedback from the students each semester. And I've been teaching, a mindfulness-based occupational therapy version of the course, and it's been just an incredible journey. I feel very grateful to have had this chance to do this. And then this is where, Jan and I met through our training in MBSR, and Jan was coming, each semester to speak about her experience of integrating mindfulness into her work. And so I'm just grateful to know Jan. I'm really grateful that she's here with us on this journey in bringing this certificate to life. And she will be teaching the first course, which is mindfulness of self. And we'll go into more detail about the curriculum in just a bit. But I want to hand the mic over to Jan so she can talk about maybe the essence of our vision together for this program, and then introduce yourself.
Yes. So I started meditating in about 1973, doing yoga kind of at the time. And about 11 years later, when I was looking to go to graduate school, I knew that meditation practice had something profound to offer for people who were in crisis of some kind, who were undergoing some sort of crisis of self, where they've had losses to their identity or roles. And I knew that this mindfulness practice was core to that. And at the time, when I wrote Saki for research articles, there were probably 2 articles at the time, which now there's thousands or more articles. But I also was finding that there was a place in practice where the rubber wasn't really hitting the road inside myself, that I wasn't really able to fully integrate practice and my own inner self knowledge that was really using life more fully as the fuel for practice and as a sort of soil, enriched nutrients for transformation. And so luckily I was able to have wonderful teachers and mentors and individual and group retreats, and really start to understand what it took to bring that into my work with clients as I went on. And this sort of inner work and engagement with support is really the primary foundation for being able to bring that presence into life, into the workplace, into being. And that, as in my own life and as practitioners, we really need to have a very deep rootedness and experiential understanding of practice, so that the research and studies and things that we use are really based on our deep inner experience and how we work with that. And our humanity and our own deeper connection with our presence, as I found in a deeper way, is really the core of what we have to offer to the people we work with, whether they're our clients, patients, our co-workers. And that presence, when it's really becoming a root in your life, really does bring about profound change and a way to really bring our humanity forth to support the core of other person's humanity and process. And it does take a growing familiarity with our own issues, our own structures and sense of self. And nothing can really replace that, that engagement. And I really look forward to helping to build a community of practice and commitment to this work together.